Dr. Rachel Matthew, founder of All Things Women. Welcome to part 2 of the video series, The Menstrual Cycle. In this video, I'll be teaching you how to calculate your ovulation date as well as which days you should avoid having unprotected sex so as to lower your chances of becoming pregnant. And for those who wish to become pregnant, you will be learning which days to have sex so as to increase those chances of pregnancy. In the last video, I used Michelle as an example, and I will continue to use her as an example in this video. Let's get started. So what happens if Michelle is having sex? How can she become pregnant? Here are some fundamental facts. If Michelle was to have unprotected sex on the day of ovulation or 3 to 5 days before ovulation or within a day of ovulation, she could get pregnant. Her greatest chances are 2 days before ovulation and on the day of ovulation. Why is this so? Sperms can survive in the female reproductive system for up to 5 days. With this knowledge, let's head over to Michelle's calendar. Remember when I said her next period was the 4th of August? Well, for any woman to calculate her ovulation date, she should count back 14 days from her first period of the following month. So, count with me. We're going to count 14 days prior to August 4th. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So after her period ended on the 12th of July, she would have ovulated the 21st of July. If she had any unprotected sex from anywhere between the 17th to 22nd, she could have gotten pregnant, and even more so if she had sex on the 19th, the 20th, or the 21st. Just a reminder that sperms can survive in a female reproductive system for 3 to 5 days. So, if Michelle had sex and her partner ejaculated inside of her on the 18th, there would have still been some sperms inside of her that could have potentially fertilized the egg on ovulation day, the 21st of July. It takes as little as 30 minutes to 12 hours after ejaculation for the sperms to reach the fallopian tube where fertilization occurs. When fertilization occurs, it takes about 2 weeks for the fertilized egg to reach the womb. And then bam! It implants into the thickened inner walls of the womb, and you miss your period. Sometimes when the fertilized egg implants into the thickened inner walls of the womb, it can cause a little shedding, which the woman may mistake as her period. Being able to track your ovulation date so as to avoid unprotected sex to lessen your chances of pregnancy is called a rhythm method or calendar method. Some women may use the calendar or rhythm method instead of contraception or birth control. However, before you consider using this method, here are a few things. You should have regular monthly periods, be able to track your menstrual cycle comfortably, not be on any contraception that will alter or change your menstrual cycle, and you should know how to calculate your ovulation date. I encourage you to watch this video as many times as possible until you're comfortable with calculating your ovulation date, and also until you know which days to avoid or which days to have sex. All the best, ladies. Thank you so much for listening.